Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Good morning. Good morning, everyone. Welcome to today's edition of our podcast series on early intervention matters. I am Dr. Inyang Takon, your host. I'm a consultant neurodevelopmental pediatrician who's been practicing for over 20 years, and I see lots of children with neurodevelopmental conditions. So I also host this early intervention matters podcast because I feel that we should be working together with families, children, young people, and families with additional needs in order to help understand perspectives and help to support them better. Our parents are also our greatest advocates and teachers. We learn a lot. So today we're going to be talking about a very important topic which affects almost every child with additional needs. And we're going to be talking about transition from childhood pediatrics to adulthood. As many of you would have had your own experiences, this can be a very challenging time for families and something that people find very difficult to get the right level of support. So I think it's important that we discuss this again. I'll be bringing on my guest, whom I'll introduce. She's a mother of two young, amazing men. Her name is Izegbua, and if you've listened to our previous podcast, she was on it previously, and we're thrilled to have her again today to share her experience on transition. But before we go on, I would like to explain what we mean by transition. Transition means different things with different people, but in the context of today's podcast, transition that we're talking about today is transition from pediatric services to adult services, or from childhood to adulthood. We do know that children with additional needs have received services from several sectors, including health, education, and social care. So most children will be receiving some support from these services, but sometimes these services are not joined up in the way we would like it to be. Ideally, it should be all joined up. Everybody should be singing from the same hymn sheet to make things very seamless. So typically for children without additional needs, they move from pediatrics to adult services at age 16. We discharge children at 16, but children with additional needs stay in pediatrics until age 18 when they move to different services. Now, the move to different services depends on the child's diagnosis and conditions. So for some children, they might be discharged back to the GP if they don't have a lot of ongoing needs. But for children who receive a lot of other support services, we transition them to adult services, which can either be adult neurology or adult learning disability teams. And this, in the adult learning disability team, this can include an adult learning disability psychiatrist who is usually experienced in the management of children with intellectual difficulties, complex mental disorders, behavioral disorders. So we discharge them to that team. And they also manage children with epilepsy in their team. So it's very different for different children. And that's why the desired situation is to have a holistic approach where all the three services are working together. But unfortunately, that doesn't always happen, and it causes a lot of challenges for families and the children who they have to support throughout this period. So we'll be talking more about this. And before I go on, I just wanted to bring on my host, Izegbua. Like I said, Izegbua is a mother of two lovely, amazing men, and she will be talking through with us on experience. Okay, I'll just allow Izegbua to say a few words about herself, and then we'll go on.
Good morning, Ian. Thank you again for bringing me back to this platform. It's been an amazing experience talking about this topic that is such a passion topic for me. Thank you for the platform, like I said. And this topic, again, is one of the critical ones that parents sometimes are so confused about and can be quite destabilizing for the family. So it would be great to delve into the issues and share my story to the best of my ability. Thank you again.
Thank you, Izegbua. Thank you. So I'd just like to start by asking what has been your experience so far. If you just give us the brief ages of your children and what has been your journey, or your experience so far navigating through the process.
Okay, so I have two young men, like you mentioned. One is 19, so he just turned 19 in September, and the other one is 17. So both of them are really at very early stages of the journey. In terms of transition planning, we've had to do that planning from birth. I mentioned that in the last podcast that when you're looking at transition, it's eventually your young person is going to grow. And so the planning can start as early as birth, knowing the diagnosis that is before you. And then at every key stage, it's always been a looming expectation that when this child maybe crosses from toddlerhood to young childhood, or they're moving on to their late years in college, if they're in school, how do you think about them long term? And then obviously we are also aging, so we also think about what happens when we're no longer here. So those are the ages. In terms of how we've tried to navigate that, it's always been a key factor in decision on where we are located, schools that we select, and making sure that we have the right team around us. And that also takes a lot of hard work from the families. So that's just an introduction into the young men. I think the last podcast I mentioned that they're both at different levels along the spectrum. So their needs are also unique. So when it comes to transition planning, it's planning according to their individual needs and what is suitable for them as they mature and they age.
Thank you. Thank you very much. So just to find out, did any professionals sit you down to talk about points where transition was going to take place? So did you have any information being given to you? Did you feel that information was enough for you to help you find, the process for your children?
Yes, and I think it all comes down to the right environment that you're in. The school that my older son is a specialist school, and they've been as soon as your child gets into year 9, they start to send you a lot of information on areas where you can think about for transition planning. There's a lot of signposting. And again, as parents that are managing the home and the young person, all of this is information. But how do you translate that information into practical steps? Right. So, and then you're thinking, okay, my child is 14. They're still 4 years ahead. And then there's so many pathways and you're not really sure because your day to day may be different for that young person if they have health needs. So yes, I've had the information. But obviously it depends on your state of readiness at that time to receive that information in a way that makes sense. So obviously it's always more impactful when you have people that have gone through the journey that can say to you that this is how it is, or this is how to break down that information in a way that makes sense to you. So yes, I would say that I've had professionals in the schools, in medical care, they've talked about it. And I've been blessed to have medical practitioners that are very practical, open, and can communicate. So obviously, Ian, I'm a fan of yours, and obviously in other sectors in neurology, in occupational therapy, the physiotherapists, they will tell you all these things. But you as a parent, when you're receiving that information, is how do you practicalize that information? I think that's where parents really need a lot of support to say, look, I've seen all of this, I've heard all of this, but I don't know what it means. Right? In some cases, when they talk about adulthood, for example, if your young person has been used to socializing with peers and people that are around the same age, and then you go into adult services, you realize that they're going to now be engaging with people that are in their 40s or 50s. So how do you find the right peer group for them to transition as they're moving, especially when they're at early adulthood? So those are the kind of things that we have to share have these conversations very early and often, and share our experiences with each other.
Well, I think you've touched on a lot of important things, and I'm really pleased that you had that support from the school, because I think it's really key giving parents information early, giving them that space to process it, and having people to support you. I think for some parents, again, that information can be quite overwhelming. And if they don't have people to talk to compare notes, to know how their young person navigated the process, it can be quite daunting. And families are in different positions at different times. And if a family has quite more than one child or two children with additional needs, it even becomes more overwhelming. So I think this is where we need to be able to talk about these things, and we encourage parents to seek out people who they can ask questions. It might not even be somebody in the school, but another family that they can talk to. Some of this can be, you can get information through sources like many places have support groups for children with intellectual disability. The county councils in most places have a special educational needs department that you can call on to ask for advisory support. So there are advisors in the learning disability arm of the county council that can provide advice. And there are also other groups like I know groups like MENCAP has a lot of information on transition and advice line. They actually have an advice line where families can call upon to get more information, but also looking at connecting with people in your community where, and that's what one of the things that we emphasize a lot on this podcast, is building a community of support, because sometimes it can be quite a lonely journey and parents can feel quite isolated, but building that community of support does help. And you talked about, you know, I think one of the things you talked about, which was quite important, was thinking about that quite early from birth, from the time you get the diagnosis. Sometimes it gets very overwhelming once you've gotten a diagnosis, and you can only think for the immediate. And you were, you were fortunate to be able to look at a school that could keep your young men till longer. So what is your advice to families when looking through that process of schooling? What are the key things they should be thinking about when looking at that process of schooling?
So the process of schooling is really important because obviously if your child is of school age, you want to be in an environment where they are not only addressing academic needs, they're also talking about functional transitioning needs for that young person. I think it's not like everything is going to be given to you as you ask for it. But if possible, if you can push for a school that takes your child up to the final stages of education, so up to age 19, that's a good way to have a good transition from the age of 10 to 19, given a lot of years to shape the trajectory of that young person, build not only educational skills, but also most of the schools that are that have that length of time in school, you have different subjects like life skills. They take them out into the community. They start to teach them how to do some self-care, building up to adulthood. From year 9, most schools will start to look at transitioning to adulthood. It's part of the EHCP. We've mentioned that document before. So that will have a plan on what are the key areas that you want to build that young person's skills as they're transitioning into adulthood. So for the age of 14, they start to really focus a lot on life skills. They start to focus on engaging with friends and community. So there's always that approach for the schools, regardless, if you're in a specialist school, regardless of how severe your needs are, they always do make sure that these young people go for residentials, they go out into the community. It's all about creating that adapted learning for them. If your young person wants to go into college, you can also consider a college that takes them up to 25. So they have specialist colleges that go from 16 to 25. And you want to look at that as a potential approach, because once they start getting to a college at the age of 19, for example, it's really very hands-on on how do you make a meal for yourself. If you needed to live in supported living, how do you support yourself in that environment? How do you adapt your home to help you develop those skills? And there's also a social care assessment that is done to see what kind of social care needs would you have. And when we hear social care, some people have this scary picture of that means that your child is going to be taken into care. No, there's a social care portion that deals with disability. So they focus on building, supporting young people that are in the community that have disabilities, and start to think about what would they need in terms of, do they need a personal assistant to support them? Do they need support in transporting themselves within the community? So there's a lot out there. It's just really to find out what that is and have a conversation with the right people on that sector. In terms of schooling, in some cases, some young people may not be able to go to school, maybe for medical needs, or they find themselves coming out of school because of whatever the issues may be. That doesn't stop the education. So yes, schooling is meant to be the traditional way. You can actually have education that is personalized to your young person. And so once you have a personalized program, you can also put in those things relating to adulthood, which is making sure that the life skills are built up, looking at travel training, community engagement. Those are the key things that we look at when we're thinking about adulthood. Now, how would that person want to live? Would they want to continue living with their parents? Would they want to go into supported housing? Those are the different things that you start to think about. And when I talk about starting early, is really realizing that when you're building up your child, yes, you're not building your child just for today, how they're functioning today, but the fact that they might live very long years. So if we're always praying for long life, we pray for long life for our children too, right? So they most likely are going to live very full, healthy years. So imagine your young person ends up being a 30, 40, 50, 60, 70-year-old. How does that look like? And what kind of planning can you put in place for that? And it starts with education, and the rest of it transitions into out of education.
Thank you, Isaac. That is it, but that's really good. I think you've also given us a lot of information. And one of the things you've mentioned actively involved parents being involved in this process. Um, you know, it's your child at the end of the day. It's your child. You know your child very well. You know what works for your child. So you mentioned the EHCP. I just to mention that is for people listening from outside the UK. That means Educational and Healthcare Plan. So it's a legalized statutory document which talks about what that child needs. There's a process to getting it, but it describes your child's needs. It describes the role of what is being provided for your child. So it's written in there, and it involves inputs from various professionals who would have seen your child, including your child's needs. So your child's voice should be represented in the EHC plan, and the family's voice, because it's about the child. So that's where you play, parents play an important role, because even if your child is nonverbal, you know your child, you know their needs, you know their desires, you know what they like. And that's where you as parents, you're a very important part of that EHC plan process and review. And therefore, if there are things you do not agree with, or you feel things are not adequately represented, you need to be actively involved in stating it there, because if it's not written in there, it's very hard to provide it. But if there are things that you say, actually, my child needs more of this, my child does, that's a place to make your voice heard and known. So as parents, we want to reassure you that you have power to contribute to this process and also influence what do you foresee for your child? Your own peculiar circumstances. What do you foresee? And also the social care assessment, Izegbua, which you've talked about. I think that's a very, very important part. So we've talked about the academic part and the different routes for the child and young person depending on their abilities, but what you, again, as parents, you contribute to that. And then you have to also think about the social care bit of the assessment, which is very important. So thinking about all these things we've talked about, I think it's important to discuss what goals do you want to achieve in terms of when thinking about the transition. What are the goals in terms of what do you see? So for Isabel, I would like you to first of all give us a summary of thinking about your own children going through the process. What would be your advice to parents in terms of setting goals?
I think a critical goal is really making sure that your young person can live as independently as possible. And when I say independently, I mean functionally. We touched on that in our previous podcast to say what independence for each person is different. But if that person can access activities, can have a community engagement, can do some basic things by themselves, so that is really something that you want to set as a goal. So once the child starts getting older, if they're not on an academic track, even if they're on an academic track, it's really important to have a very focused goal on life skills. So life skills would include things like self-care, community engagements, social interactions, money management if they're able, and then being able to access the community. So I think there are many checklists that parents can have access to, just like a checklist. There's a book that I got many years ago. It's called Steps to Independence. It's such basic things that you take for granted. Being able to make your meal, and even if it's cutting a banana or making your cereal, how do you make that young person feel competent? So that life skills is very important. I think that's a very good target and goal. And then when you start thinking about independence, you feel at some age and stage, this young person that is now an adult would want to be in their own environment, their own home. The home could be within your home, it could be outside your home. How do you want to think about that at some point in time? And then obviously planning in terms of financial support on an ongoing basis. That's another important target to think about. Travel training, it depends. And you might want to think about how do you create some kind of social group for that young person along their area of interest. So it's not all of them that may have very close friends, but do they have peers that they engage with? Do they have like a personal assistant that can take them to social activities? They need to go to the cinema. They want to go out to the park. These are things that we do by default, but for our young people, they would need additional support to access that. So just stepping back and thinking about your young person as if we didn't have this additional needs, what would a typical 19-year-old want to do? And think about them in that context, not just in the context of their disabilities, but what would a typical 19-year-old want to do? Would they want to be next to mommy and daddy all the time? Or is there a possibility to find maybe a support worker that can then be like a buddy to engage with them? It takes a lot to let go. And, once you then get used to it, or you get the right person that works with your child, you can find that you feel a bit less anxious because you're happy that your young person is experiencing the world as best as possible without necessarily being under constraints. And the good thing about this environment is that you see examples in the streets. So it's not a closed environment. So you can actually look and see someone that is severely physically disabled but has a motorized wheelchair and is navigating themselves. And for me, that is a testament of the home and the parents or the community around that person saying, I'm going to enable you as best as possible. So if we think about travel training, in some cases, you might think, well, travel training means that I'm going to get a motorized wheelchair and train that young person how to navigate it. And even if they can't, then I'm going to try and see if I can get a personal assistant that can help them go to the cinema. And, it might be that, okay, the cinema may not be at the appropriate place. Yang had mentioned there's some communities, there's some societies that come together and have specialist cinemas. So you mentioned Mencap. Mencap does that. They have cinemas where they have open air pantomimes. They have their day centers that are set up for this. So thinking about it and not looking at it as, well, whatever it is that you're looking at, just think about that adult and say, if I was an adult, what would I want to do, and how can I create a similar experience for my adult child? So those are some targets you can have in mind.
Thank you. Thank you. Touched on very, very important areas. I just want to touch on the health aspects because many of our young people continue to need support past the pediatric age group. So I one of my specialist areas is in managing epilepsy, and I do manage epilepsy in children and young people with complex needs and neurodevelopmental disorders. And that period of transitioning from the pediatric age group to the adult age group can sometimes be very challenging because, like I mentioned initially, there are different routes where they move on. So if the young person does not have a lot of complex issues, sometimes they go straight to the adult neurologist. But if the child has other needs, then sometimes they go to the adult learning disability psychiatrist who can also manage their epilepsy. When you have a similar situation where the pediatrics and the adult services are working jointly. Sometimes in some areas you have a good handover. Sometimes you do. There was a time where doing clinics with the adult team. So the adult team got to meet the young people before they moved on to the adult services. And so they started providing things for the young person and introduce themselves to the young person while the child was still in pediatrics before they moved to adult services. But obviously, that's the ideal, but things, because of a lot of problems with resources and capacity, that hasn't been the situation in many situations. So sometimes you find the young child being discharged from pediatric services, referred to adult services, but sometimes there's a gap. And therefore, parents sometimes, it's really challenging. Parents sometimes struggle a lot and find it difficult to navigate that process before they're taken over by the adult services. In times of emergencies, where the child needs to visit hospital outside the regular clinic times, it sometimes can be challenging because the child is no longer eligible for the pediatric ward. And then the child finds themselves in an adult ward where they are in the midst of, very different people of different ages. That can be very daunting for the child and the family. So one of the things I usually encourage families to do is still try and have a link with your pediatric team because they can sometimes help to navigate that process for you. So I try not to discharge people until I know that they're completely embedded in the adult services. And we give parents an open door to contact us sometimes where they're finding it difficult so that we can then help to navigate that process. So just to say to families, if you're finding such challenge, you can still go back to your pediatric team. Not that they're going to see your young person there, but they can help you with navigating some of those challenges, reaching out to the adult team. Because I know it can be very difficult sometimes. You're trying to contact a clinical team member and you can't, but sometimes your pediatric team might be able to get an email across, a contact the corresponding nurse or doctor in that team to help support you. One of the other things that I usually advise is making sure that your child has what we call a passport, a health passport. And that health passport usually provides the needs of the child, the diagnoses and all that for the young person, what you want. And in some hospitals, the team, the learning disability team, help to create a book where it has a lot of information about the young person so that when they get to hospital, everybody there knows what they need and helps to facilitate it. So these are things parents should start asking in advance. They should ask in advance about a passport. They should ask in advance about early enough. The GPs actually, it's an obligation for GPs to to have on their register every young person with a disability. So GPs should be able to do at least an annual review for that young person with a disability from age of 14. So if your child is not, if you're having difficulties, your GP can also be one person to help reach out to professionals to help support you through that process. So don't forget your GP is there to help. Your pediatric team is there, and also making sure that your child has a health passport so that when they need to go in an emergency, it can be very daunting telling stories to people who you are just meeting for the first time, who want to start going back into a lot of information that you've had over several years and don't know your child. But if you have all that information in a place, that usually helps. So these are some of the tips. But again, it boils down to starting early, not waiting till your child gets to that period where it's transition, but starting that process early, because the earlier you start, the better it is for your child. And thinking about all the kind of, there are other things like with the child, you've talked about relationships. There's also things about thinking about their own needs, their sexuality, their lives, that's all part of transition. We sometimes forget about that, but actually it's a key part of thinking about the needs of these young people, the relationships, what they aim to do like you said, think about what a typical 18, 19-year-old will need, and think about that in relation to your child. Your child is equally a young person. You need to think about, their sexuality, their needs as well. And that all comes into supporting the young person during transition, because they're now going into adulthood. So there's a lot about transition. And I think one of the reasons that we decided to touch on this topic today was to begin to get families to think way ahead of time, think about the kind of things they will need, think about all areas of that child's life, and think about the future. Because as families, as parents, we grow older. Our needs change, the family's needs change, siblings' needs change. We need to think about everything holistically. Um, so these are some of the things that we wanted to bring up in this podcast, and I just wanted to again encourage to ask you, Izegbua, that having lived in uh, another environment community before and coming over here, I'm moving to the UK. What would you say in terms of transition services? Because we know that there are families everywhere listening to this. What would you say in terms of support and transition services that I know that your children were not at that age to experience that, but from what you've known, do you think that there's that, you know, there are barriers, and what are the challenges families face there, and what could be your advice for some there and for people living here?
I mean, when you were talking about all the things you think about as an adult, I was like, I can imagine how overwhelming it is for parents. There's just a lot to think about. But Before I go into the topic of the differences in the environments, I guess I'm speaking to myself and other parents. Just be encouraged that it's a day at a time. So even when we think about every single aspect of that adult, it's not to be done in one day. It's just as you see the need is coming, you start to, take it a day at a time and step at a time, and it will be okay, right? So I had to say that to myself as I was listening to it, a day at a time. And don't worry, you don't have to do it today. I can do it over time. So I'm just passing that out there in case anybody had the same thought as I did. So in terms of the two environments, it's different, and none is necessarily better or worse, but it's just different. There's a particular center in Ikeja, and the woman is an amazing advocate for transition services. In fact, once she gets a person in her school, regardless of the age, she starts to work on that. She thinks about what those children are going to be when they become adults, which will be things like going into the community, nurturing their needs, making sure that they're as independent as possible, and start to do something like work experience, find what that young person can do, right? It's just something that makes that person feel like a contributing member of society. I think in Nigeria, we've talked about the cultural, customary, and social aspects that may be a bit of a challenge. There's a lot of work to be done to build up the social care environment in Nigeria. And obviously, the communication, being able to talk openly about these topics without feeling like you're stigmatized. Because whatever the case is, you can't keep your young person at home. There has to be something that this young person can contribute to society. It's not only one pathway of education. There's function, you know. A lot of our young people can do many things. So it's really to broaden that mindset of what can this young person going into an adult do and contribute to society. Those are the challenges that you might face in our community, and really to encourage parents to remember that they can add value. And I see it in different contexts where they're doing different things, which are highly celebrated in the West. When you're being more artistic, you're more hands-on, it's a celebrated skill. So let's celebrate what our young people can do back home and make sure that we can build their confidence and competence and their contribution to society. I think with time, as we become more globalized, we'll start to see businesses that can include people, whether they're working in supermarkets, whether they're supporting in agriculture, whatever their needs are, whether they're in the kitchen, whatever it is that they can function with. Those that cannot, because of mobility or significant health needs, it's really important that we understand that adulthood also means long-term care. And then this care has to be at an optimal, you don't necessarily have to have the most expensive care or be the richest person, but like we ended the last podcast, just giving that, acceptance and care to the best. So decency, when you think about an adult, protecting that decency, things like not looking at that adult like the adult's the child. So things like privacy, all those things that are just, things that are esteem issues for an adult. So really trying to remember what does it mean to be an adult if they didn't have this challenge, and treating them accordingly, and making sure people appreciate that you're dealing with an adult here. And sometimes unconsciously we can start to look at them like they're still children, but no, when you're looking at a immature person, the diagnosis on the needs does not mean that they shouldn't be treated accordingly. On this side, in the West, obviously there's a lot of legislation and laws and guidances that talk about how you treat people when they become adults. The individual is usually prioritized to say, what does this person want? And try to make sure that you can accommodate that. So that's where the difference is over here. And then because in the society, you can see a lot more inclusion in community. So you can be encouraged to say, look, it might be a difficult journey, but there are places where you can go to and have a social engagement. The community, YMCA, you mentioned, MENCAP, and you can get that support. Those that have the needs will all be trying to get in there, but at least you might get access to the best that you can. And then, like you mentioned, working with healthcare professionals, being able to advocate for your young person, parents will continue being fully invested in their children. even if they were neurotypical, you'll be fully invested. So we'll continue to advocate and do the best that we can using what is around us. And ultimately, I think if I think about what I think about on a daily basis, I think about the fact that there's going to be continuous development for my children, and they will start to have new needs. And how do I make sure that I can think about it in advance and not diminish? So little things like asking for their opinions on things and really letting them, giving choices, things like that. Just really getting myself to start to think about them as adults and putting myself in their shoes to say, look, if I'm going to advocate for something, what is my point of view going to be? My point of view is going to be, if I were an adult, what would I want? And what would I be able to, push for if I had the voice? So I'll then advocate for that for them.
Thank you very much, Izegbua. That's really wonderful. I think we've covered quite a lot. We've covered so much on this topic, and I just want to round it by just summarizing the things we talked about. What transition is from the beginning. We talked about the different aspects of transition, the educational angle, and thinking about how you start very early, soon after your child is born or has received the diagnosis, beginning to have a long-term planning. We talked about some of the challenges that can occur, and we talked about the role that as parents we can play in being part of that process. And we've talked about the different aspects, the setting up goals that are relevant to your own child. And importantly, you mentioned taking each day at a time, remembering that your child continues to develop each day, and each day your child is developing, and making progress and being positive. And also, we've also talked about building a community for yourself, being able to ask questions because it can be very overwhelming, and where to seek support, resources local to you. Your local county council usually has a lot of information, a library of resources. Also, think about your local libraries. They have a wealth of information on what is available for your young person. So, if you have a local library, visit there. You can contact the county council. These are resources that are available that you can contact. And think about local support groups. In most places, there are local support groups that you can connect with. And there will be people there who, many of times, these are people who have navigated the process themselves or can point you to somebody who has navigated the process, who can give advice. And then we talk about other support services. We talk about the MenCap, the resources like that, where they have a wealth of information that can be very useful for you. So I think it's important to remember that we're not alone in this, and that each young person, we keep saying, has their own trajectory, but is thinking about the support that is available for you, your family, and that to help bring out the best in your young person. And to also remember that you're never alone. There are other people to contact. Thinking about the health needs that your young person will need, and thinking about the resources that you have at your disposal, and also remembering that things like immunization um, should be part of the things that you continue to think about for the young person to protect them from um, diseases and being unwell, and also the fact that you will have to advocate for that young person, be an advocate for them long term, because where another young person would have been able to go into an adult conversation themselves and sit down, you are the advocate for that young person because you know that young person's needs, you can communicate. And when people can't understand them or think, or they can't do this or they can't do that, you know what your young person can do. You documented it and provide the evidence about, what they can do. Like I said before, keeping video recordings of what your young person can do But sometimes in the hospital, they say, oh, no, he's not doing this, he's not doing that. And they assume, based on what they can see in the hospital, whereas your young person can do a lot more at home. So keep recordings that you can share with professionals when you meet them to actually show what your young person can do. I think this is it's been a quite informative being able to, you know, get your perspective and your experience on this, and also, been encouraged by the tips that you have shared to support families. And also, even in countries where services are not that available, I think one of the things that brings, again, which we touched on before, is improving awareness within the family and community. So, where young people would be isolated in certain communities, it's about including that young person as part of the whole family and making it obvious that you're accepting your child and young person, and that makes other people realize that your young person is very much part of that family and included in activities as well, because we have a strong social network in some of our communities back home. It's about using it positively and encouraging people to provide support. So thank you very much for sharing today. And I am sure that this discussion would be helpful to some of our families. And just to round up, to say again, Early Intervention Matters provides information through podcasts. And if any of the families that have listened to this want to contact us further, they can get more information on the School Doctor website, www.school-doctor.com, and you can also make contact with me through that process as well. So thank you very much, Ms. Izegbua, as usual, for sharing your time and all the wealth of information you've provided for us today. Thank you.
Thank you so much, Ian. It has been a pleasure.
Thank you.
I hope we've been able to share some useful information. Thank you so much.
Thank you. As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.